Okay, so today we're going to be discussing pharmacology. The first group of medications is ACE inhibitors, and ACE stands for angiotensin converting enzymes. So ACE inhibitors belong to the class of medications called antihypertensives. So they reduce mortality and improve LV dysfunction in patients post myocardial infarction. So some of the medications listed in ACE inhibitors are Lotensin, Capitan, Vasotec, Lisinopril, Acupril, Altase, just to name a few. Now for your exam, you just need to know one of those medications. The other thing you want to know with ACE inhibitors is that it is an antihypertensive, but it also helps patients who have heart failure. So the greatest benefits are patients with the following conditions: if they had a suspected MI, if they had hypertension, heart failure, and an EF less than 40%. The next group of medications is antiarrhythmics, and they're used to treat abnormal heart rhythms. So lidocaine, amiodarone, procainamide are a few antiarrhythmics. So they restore normal heart rhythm in patients with certain types of arrhythmias. They can also prevent the recurrence of arrhythmias in patients, or they can slow down the heart rate of certain arrhythmias. So just make sure you know that antiarrhythmics treat abnormal heart rhythms, and then make sure you know one of the medications that are listed in the slide. The next group of medications is anticoagulants, and they decrease the clotting ability of the blood. So they prevent clots from forming in the blood vessels. So Coumadin and heparin are the two most common anticoagulants. And we do sometimes call them blood thinners, although they do not actually thin the blood, and they do not dissolve clots that have already formed. They prevent the clots from becoming larger and causing more serious problems. Beta blockers is the next group of medications, and they are beta adrenergic blocking agents. So we call them beta blockers. They're used to treat high blood pressure. So Lopressor is a popular one, atenolol. Beta blockers are also used to relieve angina and to reduce myocardial ischemia. Beta blockers can also be used to correct irregular heartbeats, prevent migraine headaches, and treat tremors. So beta blockers can be used for a variety of conditions. Calcium channel blockers is the next group of medications, and these drugs act by relaxing the muscular walls of the arteries. So calcium channel blockers affect the movement of calcium into the cells of the heart and blood vessels. So when it blocks that calcium, it causes vasodilatation. So calcium channel blockers are also used to treat high blood pressure. So Norvasc, diltiazem, verapamil, those are a couple of calcium channel blockers. Cholesterol lowering agents, the statins, these are used to treat high cholesterol. So Zocor is a popular one, Lipitor. Again, just make sure you know one of those medications. Diuretics, these are also used to treat high blood pressure. They are also used to treat patients with congestive heart failure. So we commonly call diuretics water pills. Lasix is a popular one. Hydrochlorothiazide is also a popular one. They abbreviate that HCTZ. And then inotropes is dopamine, dobutamine. The pumping function of the heart is unable to keep fluid from accumulating in the lungs and is unable to pump enough blood to the kidneys. So we would give patients an inotrope. They may have a continuous IV infusion, but anyway, the inotropes stimulate the heart to contract more vigorously. So if a patient has poor LV function, we would give them an inotropic agent. And then nitrates are used to treat patients with chest pain, angina due to coronary artery disease. So nitroglycerin is the popular one. And nitroglycerin comes in many forms: sublingual tablets, it comes in paste, an ointment, oral spray, pills, and it can be IV as well. So just to list a couple more common medications here, and these are just FYI. Atropine is used for patients who are bradycardic or asystole. We would give them 0.5 to 1 milligrams IV. That's just to speed up the heart. Benadryl is an antihistamine. If we have a patient that comes to the cath lab and they're allergic to the x-ray dye, we would give them Benadryl pre-procedure. Epinephrine is used in cardiac arrest, so it can be given IV, or we give this to the patient 1 milligram every 3 to 5 minutes in a code situation. Lidocaine, again, lidocaine is just like the medicine you get when you go to the dentist office. However, this is a different concentration. So this concentration of lidocaine would be given to patients who have ventricular tachycardia or any type of symptom with an abnormal rhythm. Low pressor, we give this is a beta blocker, we talked about that. We give this for hypertension, acute MI. And then Narcan is a reversal agent for narcotics such as morphine and Demerol. So if someone needs that reversed, we would give them 0.4 milligrams of Narcan. Oxygen is also considered a medication that's given to increase the oxygen level for shortness of breath. So we always start at 2 liters of nasal cannula, and then we can go up to 6. Romazicon is a reversal agent for conscious sedation for Versed and Valium. Verapamil is a calcium channel blocker commonly used for SVT. And then Versed is a popular sedative that we use in the cath lab, or that they use for TEE in cardiac sonography. They give them sedation, and it's called conscious sedation because we want them to be able to respond to us if we need them to move their head in a certain position.